Ostherr, Dr. V, thank you so much for joining me. You two collaborate on something called the Medical Futures Lab. Can you describe briefly, Dr. Ostherr, what that is?
Yes, the Medical Futures Lab is a collaborative center that brings together a variety of different kinds of stakeholders from Rice University, Baylor College of Medicine, and the broader UT health system to try to reimagine medicine at the intersection of humanity and technology by focusing on reinventing medical education.
So, Dr. V, can you give me an example of a type of medical problem that might benefit from design thinking or collaboration with other disciplines?
Yeah, for example, I guess one of our problem owners, one of our problems was the designing of an app for patients with diabetes. And starting from the beginning, what are the issues that a patient with diabetes faces and how can that best be solved? And there are many problems like this, communication problems, and we had a lot of interesting problems with our course.
And Dr. Ostherr, why do you think this is an important thing to teach in the context of medical education? Why do we need to get physicians when they're young in their careers?
Because it is such a big problem. Students in medical school are so overloaded with so much clinical, biomedical material and so much research that's coming out that they need to master, to practice, that the actual context, the human interaction, and the tools that we have out there to actually facilitate patient care never come into medical education. So what students actually learn about is all of the underlying disease mechanisms, but never how to prevent, say, that disease from occurring by drawing on tools like text messaging or like using an app or something like that. And so it's a big hole in medical education.
Students really should be learning how to solve problems.
Yeah,
in medical
exactly.
education, as you know, we're so fixated on memorization and regurgitation. This next generation of physicians really should be focused on taking problems and solving them. Our culture of medicine is so permission-based. You can't do anything unless you have permission from someone in your environment. And so we think both in terms of content creation or solving problems like this, that docs really should be taking the initiative and being part of this whole design process and solutions.
Wow. Yeah, the other thing I got to say about that is that the students, before they get to medical school, they are constantly using all of these technologies and are constantly incorporating them into the ways that they deal with their work in their college classes, the ways that they collaborate with other students on projects, all of this stuff that could be the foundational elements of team-based problem solving in medicine. But then they get to medical school and the door slams shut on their use of those technologies. So it's a totally lost opportunity, and we want to change that.
We do a great job of beating the creativity out of our medical students, right? So.
As a medical student, I know what you're speaking about, and I think it is a problem that really needs to be addressed. So thank you so much for speaking with me and letting me know what you guys do.
Thank you.
Thank you. It was fun.